We're Amy and Christina, two moms who learned the hard way that there's a lot we wish we knew about pregnancy and parenting.
So now we're asking experts all the questions, sharing what we've learned and what we're still figuring out, and keeping it real along the way. Welcome to What I Wish I Knew. Let's start off with a fun fact. Did you know that in 2024, over a third of all deliveries in the US were cesarean births, aka C-sections?
Neither Christina nor I had C-sections with our delivery, so we were really looking to have a candid conversation about what they're like, why you might have one, and tons of other questions.
So we spoke with the co-hosts of the podcast, The C-Section Experience, Dr. Jen Wagner and Bethany Scott, and learned a lot about the procedure itself, as well as our favorite, busting some myths. So let's get into it. Bethany, Jen, welcome to What I Wish I Knew. We are so happy to have you here.
Thank you
Thanks
so
for
much
having us.
It's going to be such a fun conversation because I have approximately 1,347 questions about C-sections.
Yeah.
Neither of us have had one, and so this is the first time we are literally like our target audience of like things we think we know about C-sections. We've never experienced it, so I feel like that's a good starting place.
Yeah, there are things that people should know, even if you haven't had one or if you're planning on getting pregnant again. So that's kind of what we're here for. And
Yep.
let's talk about it.
Yeah, let's bust some myths. Let's karate chop some
I like
about
that.
C-sections. And one of the first one is like, why? I want to know like why people get C-sections. Is it just because of vaginal birth like can't work, won't work, something's going wrong? Like what? Why does someone need a C-section?
Can we take that?
I'll take that.
Okay.
Well, I will start because my journey was never going to be having a vaginal delivery, which was a big thing I had to wrap my head around because I started in the birth space as a birth doula. So I kind of really only thought my births would go in a certain way. And then due to some medical reasons and honestly, a lot had to do with just like my anxiety level because I had had a stillbirth previous to my live children. It really paved a different path for me, which is why I think Jen and I spend so much time wanting to give C-section moms, good advice and having like a safe space to go because it's not always what you thought your birth would be, but when it ends up being that, you want to feel supported as you should in either mode of delivery. So I walked into my deliveries knowing they were going to be controlled, knowing that I was going to have a C-section. And that was the best decision for me and that on the advice of my medical team as well. And I mean, I couldn't be more happy with that being the way that I birthed my children because I felt control and I needed that in my deliveries.
It's so interesting to think about a C-section as something you control because in a lot of ways, like you actually aren't doing, I don't know how to phrase it. You aren't doing the work the way that like a labor and like a labored birth, vaginal birth would be. But there is so much more within your control that you know.
Yeah, especially on a timing front. But I think that's one of the things that is a bit of a misconception in general when it comes to control, because there is that perception, I guess, that this is something that is done to you. And we try to give people back a sense of control who feel that way, because there are, for example, choices you can make, options that you have to make it more personalized to the type of experience that you want. So I would say as the anesthesiologist, I'm talking to the patient the entire time. So after you got your anesthesia, in order for me to know that it's working, I'm saying like, how are you feeling? What are your legs feeling like right now? Like we do all these tests to make sure that it's working properly. And so I need that participation from them in that sense. And then during the birth, like, yes, it's a crazy thing to wrap your mind around. And that's something that even when it goes well is like, that's just, there's no getting around that. Like, it's just a wild experience. But I think birth can be wild in other ways as well. But, you can be there to be, see the gender of your baby for the first time, hold your baby in the operating room, be talking to your OB or your care team, the people taking care of you, choosing the music that you want playing during your birth. Like there's all these ways to be like there in the moment, like seeing your baby for the first time, touching your baby for the first time. All that happens in the operating room while you're technically still having surgery. So you're there, you're in it.
Yeah, I was going to say that too. I mean, for me, I really wanted to be talked through the surgery. And I think that that's where you decide as a patient as well. Like, are you somebody who wants to be kept in the loop for the whole time of what's going on? Or do you just prefer the medical team to do what they need to do? Maybe they're having a conversation, but you can for sure speak up and say if you want to be a part of the process and where things are. And I felt that that was also helpful for my partner, because when you're on the bed, your partner is right next to your head. So I felt like it was also comforting for him to have an understanding of where the process was in the surgery, how long it was going to be until we met our baby. And then once we met the baby, of course, I took on the role of directing him, take pictures, put the baby by my face, and I
not that angle.
Right, exactly, all the things. I'm like, go over there. And so I think that there is so much that you can participate on. And I like that Jen brought up the music aspect. That was not something that I went in to my deliveries knowing, but we know now that that is something that you can ask for. And we had one of their sweetest audience members write into us and say that she had Tiny Dancer playing when her baby was born, and how that made her feel so a part of the entire experience, that her and her husband were in charge of getting to pick what their baby heard for the very first time as it entered into the world. So I think there's so many ways to integrate these really special moments. It doesn't have to feel so clinical.
Mm-hmm. My best friend's baby, she had a C-section, and she was born to Lover by Taylor Swift. And to this day, I can't even hear the song without sobbing. It's not even my kid. So yeah, that's powerful.
Yeah.
And back to your question on why people have C-sections, like Bethany's situation is extremely unique. But I think I love that we have her perspective to make people understand that there are so many reasons why someone might feel like that's the safest choice for them. Personally, I had a C-section because my daughter was breech. So I would say like about a third of C-sections are repeat C-sections. So someone had a C-section before, they're having a C-section again, and we know that doesn't have to happen, but certainly there's a reason that, some people might choose that route. But then the rest of them, if you're having a C-section for the first time, sometimes it is that there's something going on with the labor. So the labor is not progressing, it's not moving on in a way, and the baby needs to be delivered for some reason for the mom or for the baby, and so they can't wait, I guess, longer. The other thing is, besides the baby's positioning, is if the baby's not, they're worried about the baby, like there's something going on with the baby, they're monitoring the heart rate and the baby does not look happy, baby needs to come out and be born, and would be safer, outside mom than inside mom at that point. So, and then there's all kinds of other things like issues with the placenta, like placenta previa, anything that's by the cervix that's not supposed to be there, the placenta, the umbilical cord, something like that. Or, there's all kinds of, like, if you think about the mom's anatomy, let's say she has a broken pelvis or some reason that she can't push, it wouldn't be safe to push the baby out, or something wrong with the baby that the, moving through the birth canal would be unsafe. There's all these other more uncommon reasons, I guess, but or other surgeries on the uterus too, like not just a prior C-section, but let's say you had fibroid surgery that now, having contractions would be risky. And so that's, if you're having a scheduled C-section prior to labor, then, those risks aren't there as far as the contractions and everything. So there's a lot of reasons. Yeah.
I have another good friend who had 2 scheduled C-sections because she has a blood disorder. And so they couldn't risk her having any kind of hemorrhaging or anything during a vaginal birth. So a C-section allowed them to have a lot more control over that element of it. So you're right. Now that we're talking about it, it's I actually do know different people who had C-sections for very different reasons. I do want to ask about the having a C-section after you've already had one, because I have seen, what do they call it? Like a VBAC? or
Yeah.
feedback.
I
So
had one of those.
yeah, so talk to us a little bit about like why does it make sense? You said earlier like it makes sense sometimes to do a second C-section but you don't have to. Like what's the deal with that?
So the risk with a prior C-section, now you have a scar on the uterus. So there's a risk of uterine rupture that is not huge, but exists. And so there, in most cases, is a choice that the mother can make. If they're fine with the C-section, you have to think about how many babies you want to have and how, the risks of C-sections increase with how many C-sections end up having. But if you've had one prior C-section, for me, I had no reason to have a second C-section other than that I had one C-section before. And it was valuable to me to try and have a vaginal birth because my recovery was really terrible and I didn't want that again. And now I had a toddler at home. So there is more of a push towards just making it known, I guess, to people that a lot of the times the risks aren't so high. There's risks with everything, with either way. Like this is never this is safe and this is not safe. It's always a risk benefit discussion. And this is one of those scenarios where, you have to look at the person, and if the risks are pretty low to having a vaginal birth afterwards, as far as the risk of uterine rupture, many women decide to go that route. Every time you try for a vaginal birth, there's a risk of C-section too, anyway, though. Right. So it's not a guarantee, right? Just like if you're having your first baby and you're going for a vaginal birth, it's not a guarantee either. But it's, more and more women are going for that option, or they feel comfortable. They say, I already had a C-section. It was fine. My recovery was fine. Everything was good. Or now I have a second indication. Maybe I had a prior C-section and now this baby is also breech, or I had a prior C-section and my baby's, measuring off of the charts large, and they don't think that, it's just like you have to add and look at all the different factors when you make those decisions about having a repeat C-section. And like in Bethany's case, like her reasoning didn't change. Like it was the same every single time. It just that this time now she also had a prior C-section to add on to that. So.
Well, and I will say the benefit of having a second C-section and a third C-section is I could control what was going on at home. So I could go to the hospital. I knew I wanted that first OR time. I knew that I could set up my family to be comfortable with the babies while I was going to be gone. And so I think there's a lot of benefits if you need to have that sense of control too, even if you were maybe thinking about a vaginal birth, but you look at all the dynamics at home and you're like, I don't know if I can be spontaneous in this. And if I need to take that control and have something scheduled, that's okay. And I think that sometimes we don't give enough weight to what's best for the mom's mental capacity of how much you can take on, how much can you juggle all at once. And especially for my third, being a COVID baby, that was a very interesting birth to navigate because I could only have somebody come right before I was going to leave for the hospital because I was so concerned if I tested positive, would I not be able to be around my baby? And so, obviously times have shifted dramatically since then, but for a lot of people, I feel like that control can be really nice to know that things are set up successfully at home so you can go and birth that baby with a little bit less stress.
I love that point too about preparing, right? Having gone through a C-section, then understanding what needs to happen at home to make sure that you also have space to recover. I think people don't always really understand how major this surgery is.
Yes. And I would say too, that's the benefit. My first time, I learned so much about how I wanted to be prepared the second time, which is why Jen and I do spend a lot of time talking about those things because you're recovering physically, but honestly, it's just as much of recovery mentally that you're dealing with. If you're not set up for success at home, I mean, it's just adding another layer onto all of this of recovery, taking care of a newborn, taking care of maybe another baby. And so I learned every time how to do things better, how to make things easier for myself in my recovery, what things I was going to buy ahead of time so that I wasn't sending my husband out to CVS, at 1 a.m. to get something. And I think those are all the little things that when you can take back that control, it just makes you feel so much better.
remember when I was about to give birth to Olivia last year? So I was an hour away from my hospital in like rural Texas. My husband was about to graduate from flight school. So we had family coming in. It was Thanksgiving. And I was like, I can't spontaneously have a baby in these conditions. So we actually scheduled an induction a week before my due date because I was like, I cannot. I need to have control over this because like I need to have some time before family comes. Because for me, it was really important to just have like us for a little bit. And like,
Yeah.
so I totally get that.
Yeah.
Like, I have an element of control and like family life is crazy.
Is it true that in the past, the way that C-sections were, I don't know, the way they were done, um, it's a smaller scar now than before. Is that right? Is that a myth or is that true?
So I actually, that makes sense. I don't know exactly. So the incision has to be, now I'm forgetting if it's like 6 centimeters. It has to be obviously big enough for the baby to get through. There are certainly bigger ones, and there are, different locations of the scar. So some scars are very low down, like in the area of the pubic hair, and some are kind of higher up. But I think one of the big sources of progress, I guess, when it comes to the scar is the treatment of the scar afterwards, the things that we can do, the role of physical therapy, and all that they can do with preventing, basically like really ugly looking scars, which I know is a concern for a lot of people. And especially if their C-section was unwanted or traumatic, it's a reminder on your body, and it's important. Yeah.
It's a trade-off. It's like either you have this scar that you live with for the rest of your life, or like your hoo-ha gets banged the fuck up. You can't, it's like, it's a lose-lose. You do it one way and it's like, oh, things might never be the same that way. And then you do it another way and it's like, things are not going to be the same there either. So
yeah.
Welcome to motherhood.
Another semi-myth though, as far as like, maybe not your hoo-ha, but like your pelvic floor and, all of that. I mean, certainly the risks of dysfunction are a little bit higher after a vaginal delivery, but a lot of these things that go on in our bodies happen during pregnancy. So regardless, like things are not going to be the same because you've been pregnant and you've carried a baby, and all the changes that happen to your body just from pregnancy alone are, don't prevent like,
the difficulties,
whatever thing you're thinking about at this moment.
That's what I was going to ask about also is let's talk about the recovery like as its own topic, because I'm dying to know more about that, having never done it. But around things like, the collapse of your pelvic floor, or, how long you bleed after birth. Christina and I both, that was like one of the triggers for starting What I Wish I Knew, was we were like, no one told us we were going to bleed for 6 weeks after giving birth. Like, why didn't anyone tell us that? You're wearing diapers for way longer than you think. Do you bleed the same after a C-section?
Yes. I think that's one of those things that I just can't believe it's not a teaching, given that it's not more common.
Right.
Because yes, whether you deliver vaginally or by C-section, that uterine lining still has to shed. Now, some people will bleed more than others, but you will definitely, you're going to need some pads after you deliver a baby for sure. And for a couple of weeks, which is why like having a caddy next to your toilet with different size pads is super helpful. So like when you first get home, you're going to be using those heavy pads. It's also a safety measure so that if you're concerned about how much you're bleeding, you can call into your OB and you can give them an accurate description of like, well, I just bled through a heavy pad is very different than bleeding through a light pad. So that's one of the teachings I love to give as well, is like be super organized with that. Like just have your heavy pads out. And then when you're done with those, just have your medium out. Because again, when you're sleep deprived, you just like, I don't even know what I just had on anymore, actually. That's normal.
When you think about like, so yes, you definitely bleed afterwards, and having had both, I don't remember a difference. Maybe there was like a slight difference in one or the other, but I couldn't even tell you which way it was. And there are some people who like don't bleed that much after vaginal delivery, and there are people that don't bleed that much after C-section, or vice versa. As far as risk of actual hemorrhage after, it's, oftentimes, causes for hemorrhage could be like something retained in the uterus, which can happen with either delivery or the uterus not contracting properly, which can happen with either delivery. So there aren't really a ton of differences as far as bleeding. Yeah, my friend who like had vaginal deliveries previously and had to have a C-section for placenta previa was like, so good news, like no diapers for me afterwards. And I was like, I am so sorry to tell you.
Yikes.
But it's the
happening.
same, girl. I'm so sorry. She was so
God.
pissed.
Just a little
Yeah.
vacuum in there, like, you know what I mean? I don't know. Okay, can we walk through what a quote unquote, like a typical C-section would look like? Like, tell us like everything that happens and how, like, from the moment, you know, okay, maybe from like the moment you're like in a room, right? You've just gone to the hospital, you've got your gown on, you know, what happens? Because I think
Assuming that it's a planned
Like a
C-section.
scheduled.
Yeah, scheduled. Yeah.
Mhm.
Okay, so I can do that. So you usually get to the hospital about 2 hours prior to your scheduled time, but something people should know is that your scheduled time doesn't mean it's actually going to happen at that time, because labor and delivery is a bit of an unpredictable place. But at least 2 hours prior, you have to get oftentimes your labs drawn. If you haven't gotten them drawn like the day prior, you have to get an IV placed. You have to sign consent forms. So you'll, with your surgery team, your OB and your anesthesia, whoever's going to be doing anesthesia for you, you'll get some medications potentially before you go into the operating room, which could be Tylenol, which is for pain after surgery. Antibiotics usually given the OR. But you're sort of, put in your gown and ready for surgery. And then another thing people don't really often recognize is you often have to leave your partner or your support person when you go into the operating room initially to get your anesthesia set up. So essentially you will go into the OR by yourself with the nurses or whoever and get your anesthesia, which is usually a spinal for a scheduled planned C-section. So you would get your spinal anesthetic.
Is that the same as an epidural, or is that different?
It's doing the same thing, but it's a different procedure. So a spinal is just a single injection into the fluid that bathes your spinal cord and numbs the nerves. And an epidural is a catheter that sits in this epidural space, which is just outside of that fluid. And the medication like goes through the membrane and reaches the same nerves in the same manner. But we use a spinal usually because it's just like a single injection. Nothing stays in your back. We know how long it's going to take. It'll take as long as, C-sections typically last, versus labor where you might have an epidural for a day or 2 days, or you have no idea how long. So you're going to just keep redosing that epidural as long as you need. And it's just like, it's more reliable. It's quicker. It's kind of easier, some slight lower risks usually with spinal than epidural. So that's generally what we do. And then once you have your anesthesia in, usually get a catheter placed in your bladder, which stays in place for a few hours after surgery. And what else do we do? We put monitors on you. So you have to have like surgical monitors. So like a blood pressure cuff, an EKG leads, and a pulse ox on your finger. And they have to clean your belly, cover you with drapes, and then
Compression boots. Can't forget that.
Oh yeah, sorry. Bethany loves compression boots.
I love compression boots.
What are those? What are those?
I had those for my epidural. I had compression boots. They were great.
Use it.
Wait,
Yeah.
what are they? I don't know what that is.
Do you want to extend with there, Jen, or you want me
It's
to?
just like these wraparound things on your calves, and it squeezes your legs like intermittently, and it helps prevent blood clots. And I don't,
So it's like
I don't
a calf
even
massage.
It's like a calf massage, yeah.
I love that way to think about it.
I didn't notice them, but Bethany always talks about them. And it's funny because when we have people write into us, like there are people that are like, what were those? What was that? And that's the thing about not being, I think people, especially if you know you're going to have a C-section, I think there are things you can do to prepare, because sometimes it's not even that something is bad. It's just when it's unexpected and confusing and you're just like, what is going on? And you don't feel like, we talk about that sense of control. Like you're like, what is happening? And I think maybe if you just know, like there's going to be things squeezing your legs, like you probably wouldn't care.
Yeah.
That's my guess, So then we have to make sure you're totally ready for surgery as far as the anesthesia, and the drapes are up. And so the drapes cover, they go up like at the top of your belly, like they go up in the air, so you can't see the surgery, and it's covering your entire body except for like there's a hole, like a circular hole in the middle, which is where they actually operate. Does that make
Whoa.
sense?
Hold on, I'm visualizing that in my
So
head.
it's going up, but
That's
also over.
yeah, so it goes
Yes.
like
Like an L
this. Yeah.
Yeah.
And then
Yeah.
they cut out your around your belly.
And there's like a hole. Yeah, it's already pre-made, so there's a hole, and those where they're going to need to be work, and then everything else is
Oh.
covered, and then the drape kind of goes up in the air, and I clip it to 2 poles, so it's like across, so it's like a
Like
It's like a skating ramp.
yeah,
It's like a skateboard ramp.
It's a surgical drape. It's like for all surgeries we do this too.
Yeah.
So for me, it's like I don't even think about it because no matter what the surgery is, like where they're working is open and everything else is covered with the drape. And then usually the person's face, even if they're asleep, is not covered because the anesthesiologist needs to have that available. But yeah, so it's there's something called a clear drape, which some people talk about as with genital C-sections. Have you heard of it?
Yeah, look at you shaking your head. Why would you want to clear drape?
There are people that want it, really want it.
It would be like
and-
Kourtney Kardashian who like delivered her own baby. She'd be like, I
Yes.
want a clear drape. If you're gonna have to do a C-section, I want to see
Totally.
everything.
I
Kourtney
wonder
Kardashian would.
if she had one for her last baby. Does anyone know?
Let me call her. I'll
Yeah.
yeah.
But yeah, so with that, it's like usually a 2-sided drape. So one side is opaque, and then during the delivery, you can pull down the opaque side and then see. There's not really a lot to see. And I mean, I didn't see my like vaginal delivery. Like I know you can, if you have, but I certainly was just trying very hard to get that child out. But like, please come out. But yeah, so there's a drape that covers you because most people don't want to see, but some people do. And then
But your partner can see. Like
No.
so like the person can't see, but if the partner's not allowed to like look over and see.
No, not usually. And honestly, like what I try to tell people who want to do that is like I look over the drape and kind of can sort of see, but it's like the surgery is kind of going on under your bump, if you can imagine.
Mm-hmm.
And there's also like a lot of hands and people like kind of covering it, like hovered around. Like there's usually at least 3 people at the surgery, like where the surgery is happening. So there's at least 2 surgeons, and then there's like a tech that's handing instruments and stuff. And sometimes there's more people. So if I really wanted to watch a C-section, I would stand at the feet and look up.
Oh,
It's like
okay.
the
That makes sense.
best
Right.
view. Yeah. But as they're pulling the baby up, like they want, sometimes we do delayed cord, most of the time these days we do delayed cord clamping for a minute or so. So you're not, the baby's still attached to the mom, like sitting on the mom's belly. And that's a situation where you could look through and like see your baby while the baby's still attached to you.
That's pretty cool.
Yeah. But like, you don't need to see like the actual
Bethany, did you want to see?
surgery.
I mean,
Were you like, I'm so interested? Or
I
were you
would,
like,
I would have wanted to. I think it would have been really cool to see the placenta. I wish I would have asked for that, but I was just so like laser focused on like meeting that baby. But what was the thing I was just going to mention about? Oh, with the partners, I feel like always having a conversation with your partner beforehand, like how much do we want to see? Because they're just much as part of the process as well. And I feel like I did ask my husband, I'm like, he's not into blood, into science. So he was like, I don't want to see anything, Bethany. Like, I don't want to cut a cord. I don't want to see anything until the baby is like cleaned off. Now, I thought it was like by my 3rd, I was like, listen, I'm not going to follow everything you want. I want to see that baby right after delivery. And something too that I think a lot of people don't realize is that, like I knew every time my baby was delivered because I could physically feel that weight being taken out of my body. And I think a lot of people think with, you're going to be completely numb, you're not going to feel sensation. And that's not the case. You can still feel that difference of that weight being pulled out of your body. And for me, it's like the same thing. It's like just so like liberating to be like, oh my gosh, we did this. You're out of me. And I think that's also a really cool moment to I don't know, to just recognize and have a pause moment, just like in a vaginal delivery, when you feel that baby actually exit your body, it's the wildest feeling.
Yeah.
Mm-hmm.
Bethany, I was actually going to ask you that, like, if you could feel it, because I remember I felt when Olivia was born, it was like the best poop of my life.
Yeah.
I was like, yes.
Totally.
So
Yeah.
it's really cool that with the anesthesia that you can still feel like, not, I wouldn't say pressure, but like weight, I guess.
Yeah.
Yeah, I could feel a weight difference 100%. And again, I was also asking my OB to talk me through it, but even if she had said totally silent, I would have known the second my baby exit out of my body.
Mm-hmm.
So I didn't have that, but on the note, if someone's listening to this who's like, I want to know about C-sections, I think something that's very important for people to know is that you do feel kind of movement. It's like this very bizarre thing. It's very hard to explain, but it's not like you're completely disconnected from the part of your body that's numbed. So there is this, and they also kind of like sometimes they push down on the top of the belly to kind of move the baby towards the opening, which is at the bottom of the belly. Sometimes it's, uncomfortable. And now there's a whole other conversation about pain during C-section, which is too much to get into, but that's not okay. But normal things would be that feeling of movement. You kind of like know that something is happening to you, but it doesn't hurt. It's a very bizarre thing. And the other, like, you just made me think of a positive thing about a C-section. And I feel like I can speak to this having had both. And of course, everyone's experience is different, but in a really nice, well done C-section where your anxiety is under control, your anesthesia is perfect, and everything is going well, which is the situation that I was in. And I came in first thing in the morning and I was the first case and I didn't have to wait. And I was so clear-headed in the moment that my child was born that I remember that moment like so well, which I think was so amazing, like versus, I'm very glad I had the VBAC. I highly recommend VBACs for anyone who like is a good candidate and wants to do it. But I was so exhausted. I had been laboring. I hadn't slept in 2 days. Like I had pushed for 3 hours. I was like on some other planet. And when he came out, I was just so happy that he was like, I didn't have to do this anymore.
Mm-hmm.
And I didn't have that like crisp, clear, like moment. Like it was like just so many other things. So it's just like situations are so different for everybody and there's pros and cons, but just so people know, like that could be like a really beautiful moment that maybe is like even harder to get with a vaginal birth where you're pushing a baby out,
Totally.
Actually, I think
100%.
that brings up a good point that some people like, I won't have the same bonding experience if I have a C-section versus a vaginal. And I think for a lot of women, bonding after you just delivered a baby, whichever mode it is a little challenging because our bodies have been through so much. And a lot of times, I mean, at least I felt it was like really the hours after my delivery that I began that bonding process. It wasn't this like immediate, like, oh, we're bonding perfectly. It did take some time. And I think that's something to normalize as well, is that it's not the mode of delivery that's going to affect how you bond with your baby. It's so many factors that play into that bonding element.
Oh yeah, for sure. We've talked about this before, Christina and I, about like her experience with her first and mine after my first were so different of how we bonded, how we felt. We both had vaginal births for all four, but I was like, yeah, I was very disconnected. I was tired and I had like an easy labor. It was uncomplicated. It was quick. My water broke at home. Like it was not a thing. But afterward, I was just kind of like, oh my God, like what is happening?
Like,
and I feel like,
yeah,
what's happening? And yeah, you are tired. You're like out of it. It's a very like jarring experience. So to the point we were making earlier about like C-sections having this like stigma of being traumatic, I feel like the experience you described, Jen, of like it was planned, everything went generally how you wanted it to, and you were totally clear-headed. That to me feels much less traumatic than someone who, like you were saying, like you go through physical labor for hours or days sometimes. You have complications. Like by the time the baby comes out, there's so much happening. You are physically just depleted. I don't know. There are really pros and cons to both. And I don't think it's
Yeah.
fair to say that one is easier than the other. You know,
100%.
recovery wise, even I know C-sections are really different recovery wise, but like, I gotta tell you, I have never felt so beat up than after the birth of my first child. Like, I was unbelievably incapacitated for how I thought I would feel after giving birth. And I feel like I've had friends who had a C-section and they were like up walking no problem after a day. And I was like, I can't sit up on my own. Like,
But
I'm
then
too.
also, to add on that, Amy, this last vaginal birth we had, you and I both were like, wow, we feel great.
Oh, yeah. The second time we were like,
Good.
yeah.
That was me with my VBAC. I was like, what is this world where I gave birth like a few hours ago and I'm walking around and like,
Yeah.
obviously not normal. I'm postpartum and now it's my second. So I knew what it is to be postpartum. Like, you're not like back to normal, obviously, like not for a long time, but I felt so great. And you're right. It's just so variable because of course there are people who have like tears or like really, you know, like for various reasons, like their recovery is difficult. But for me, it wasn't. And for me, my C-section was, and like, you know, vice versa. And I think it's all about like, okay, look, if we look on the whole, if we're thinking about C-sections, I don't know how many are unplanned, but like a lot of them are unplanned. So, and even that in and of itself is like going to be like difficult for most people to process. And so if you look on like about trauma and stuff, so maybe it's more likely in that scenario than in a vaginal, but that doesn't mean that it doesn't exist on both sides. And same with recovery. A lot of people like just really like have no issues with recovery, which is why we just like to like put a voice to either of those sides and to say like, it's not guaranteed. Like, you don't have to, it doesn't have to be like this way. Like, and let's talk about the recovery and how can we make it more likely that your recovery will be better if you have to have a C-section or you want to have a C-section for some reason that's usually very personal and very unique to you. You know, what can we do to make it better for you? Like, I just think it's important to talk about those things because there are ways we can make it better if you're not just lucky, I guess, you know?
Totally. And you know what pisses me off, and I haven't even had a C-section, is that like there is no physical therapy. Like, there is no like, why isn't the nurse coming to you? Like, why isn't scar management like red lights and silicone and like, why isn't this like, why? I'm mad for you.
We recently just did a recovery series, and it was honestly, we had an OT and a PT on, and it was so wildly interesting because like there are so many little things that could be integrated that would make such a massive difference in one's recovery. And we're just happy that there are women like that out there that are pushing this forward and bringing this all to light, because if that was integrated in the hospital, it would for sure set women up for such better success when they got home.
Yeah. And we didn't have any of that. Like, we were just like, good luck. Here's like a brand new baby. And I never had surgery before, and like fresh surgery, and like, good luck, Steven, 6 weeks. And so we're very passionate about like, you know, changing that. And I think part of it is knowing that it exists, right? If you don't know, you know, ideally it would just be given, you know, presented to every woman who has a C-section, but like, I think we're a little ways away from that eventually. But for now it's like knowing about it. And so we can be our own advocates sometimes, unfortunately.
Well, if there's somebody I need to fight, or if I need to go protest somewhere,
it's the man, Christina. You got to fight the man.
Exactly.
Well, the men get the physical therapy after their knee surgeries, you know,
right?
Right.
But we
but
don't
not
care
after
about,
like.
Yeah. And like, of course, like you said, like everything that comes with like being a new mom and everything that goes on postpartum, and then also recovering from a surgery at the same time, like even for people that it's not a big deal, like it is, you know, like that is just an extra layer. Or if you're recovering from some complication from a vaginal delivery, like these are just layers of things that just make it harder. It's really hard.
Another thing I asked for in the hospital, which I encourage anyone, is I was just like emotionally not coping very well. And there was a nurse that knew how to practice Reiki, and she came in and did a Reiki session on me, and it changed everything for me. And so if I could scream that from like the mountains, it's like, ask while you are recovering in the hospital, what are the resources that they have for you that they could bring in? Because sometimes it's just letting that nurse kind of think like, what else do we have here? And let them do the problem solving for you. But if you don't say it, they're not going to problem solve for you. So, and you're not ever being
Totally.
like needy. I know, like, even like when I was in the hospital, I was like afraid to like ask a lot of questions sometimes or hit that nurse's bell too many times. Because I've like been on the, when you're on the other side of it too, you're like, I don't want to be that patient. But you are never like, who cares if they
Yeah.
feel annoyed by you? I mean, really, who cares? Like,
But
if it's going to
also,
help you,
the nurses are this. Christina and I have talked about this too. Like the nurses are the superstars here. I could not.
totally.
I can't even picture the two humans who delivered my children, like who literally brought them to this world. Could not tell you a thing about them. I barely remember that they were women. They were women. That's about all I remember. The nurses, I
Don't
remember
worry,
their
Jen. We
names.
appreciate you as the
Yeah.
anesthesiologist.
Oh, anesthesiologist. At that point, I was like, stick it in me. I don't care. I didn't even look at him. I was like, get behind me. Hurry up. But the nurses are the ones that like, I literally remember all of them. I know, like we talked about our families. Like I brought them gifts because they are the ones who, after this birth, like they are wiping your ass. They are
Mhm.
wiping your hoo-ha. They are helping you do everything. And honestly, I know I had a great experience because I had great nurses, but they never made me feel like anything I needed or anything that happened was even 1% weird. Like they were
That's
literally
awesome.
rolled with it. I had intense hemorrhaging. So my uterus didn't contract. So like I had a whole thing. It was an emergency and it was like blood. I mean, everywhere. And afterward, I made it to the bathroom and I came back and I was like, I'm so sorry. There's blood like everywhere. And she was like, oh, it's fine. It was like not even batting an eye, cleaned up the most heinous murder scene in there. It was, and they're just like these angels who are there for you. And it's like, yeah, I don't know. I can't say enough about nurses because I like love them deeply. But yeah, anyone who's helping you postpartum should be in that mindset of like, what can I do to make you feel better right now?
And
Totally.
L&D nurses in particular are just like, that's why I love my job, because like I get to work with L&D nurses and I love them and like they
Angels.
make my job amazing. Yeah.
It also brings up another point that if you don't love your nurse, it's okay to ask for a change.
Ooh, I didn't know that.
I didn't know that either.
You could
Yeah.
dismiss a nurse and be like, Psh, no.
I mean, it's like anything in life. If you're just not jiving with someone or you don't feel that they're like really doing what's best for you, and I think in that like acute postpartum pain or phase, you're so sensitive to so many things. So like if somebody isn't talking to you in a tone or they're not giving you the patience that you need, it's 100% okay to ask. I had my husband do it. I put it on him, but
Totally.
I think that's
that's good
so
to know.
important though, to have somebody there to support and say, like, voice the things that you can't voice. Like, and I was just laughing while you were talking about that, Bethany, because like I remember apologizing to the nurses as I was pushing that I didn't have music on. And like, is that not women in general where it's like,
yeah.
I'm so sorry we're not listening to music. Like what was I thinking?
I know we're about at time. What I wanted to say is there's a million more things we could talk about when it comes to C-sections. And in fact, you probably have already talked about them. So number one, anyone who wants more information on C-sections, go check out the C-section Experience podcast because there's a million things you can learn. However, I want to ask you while we have you, if you could say each of you give two things like top line, what do you wish parents knew about C-sections? And I don't mean going into a C-section because maybe they don't know they're going into it. Just in general, two things you wish parents knew about C-sections.
My biggest tip is to enjoy that time with just your baby and your significant other right after delivery for that first hour. It's always like people want to come and visit you right away. That is 1 hour of you getting to all be together and have this magical time without interruption. And it's not you being selfish to have that time. Let the in-laws know everything's safe, baby's good, but have that golden hour with just the unit of your nuclear, your spouse, your baby, your babies, and enjoy that time to recover. Now you go, Jen, and then I'll tell my second one.
Okay. All right. So what people should know. Well, so like, I just think it's important to know that people can prepare, and there's a lot of things that, you can learn that would help, potentially make your experience better if you know you're going into it. But if you haven't prepared, I think that your recovery is so important, and that to really think about how you're going to process that recovery. And that might be hard because you might have to be figuring that out like in the days before you leave the hospital. But, you know, how important early movement is and taking it slow, of course, but really getting your body moving as soon as you can. And I would say, what are my other favorite things about sleeping, lying flat to help with improving the look of your scar. I think that's a really good one.
Like on your back?
Like on your back. So so if you're like standing upright, you have like the gravity kind of pushing down on your incision, or if you're sitting upright, but when you're laying flat, like there's nothing kind of putting pressure. There's the C-section shelf is that whole thing. And then even laying on your stomach once you've healed a little bit more. I would say push for that 2-week postpartum appointment because you're going to have questions about your incision, about your recovery. And I think it's hard for people to make that phone call sometimes to the OB. And if you're actually going in at 2 weeks, I would prioritize that and ask for it. And your anesthesiologist is really important. So be nice to them.
Okay. My last one is get yourself a whiteboard that you can document things on. Like how many times you've changed the baby's diaper. Was it a pee? Was it a poop? What you've done. Have you taken your medication? Let that be somebody, you can task somebody with that as well. With all your helpers. If you have a lot of helpers, give them task.
Most people will be taking some kind of medication, either a stronger pain medication or at least just like Tylenol and Motrin. And then sometimes a stool softener. So you're going to have all these extra things to keep track of aside from like what everyone has, the poops and the pees and the like, how long did you breastfeed on each boob and all that stuff. Like there's an extra layer. And so having a system, whether it's a notebook or a whiteboard, someone to help you with that system so that because your brain is like so foggy, I think is really important. If you're monitoring your temperature, if you're worried about any like, just all these post-surgical things, like if your incision is looking infected or you're worried about like something going on with your own body or monitoring your blood pressure, like a system for that is just like really important.
Yeah.
Bethany, that's very type A of you. I'm proud.
I know.
Very type A.
I had to say it before Jen took it. I'm Jen.
That was mine. I'm pretty sure you took that from me.
I told you about it, girl.
Well, thank you guys so much. This was a great conversation. We've never had 2 guests at one time. So I think it was just like the charisma and vibe were A+. I loved it. Before we wrap, so I already mentioned your podcast, but where can people find you?
So I would say our Instagram is the C-section experience. And I also have an Instagram, Jen Wagner MD. If you want to email us, hi@csxpodcast.com. We love entertaining questions and it gives us ideas for future things to talk about. We love talking to people, so come find us if you want to talk about C-sections. I don't know.
TikTok, you forgot to mention our TikTok.
Oh, we have TikTok. We're
and
so bad at social media, but we're trying.
It's hard out there.
It's
so
hard
out
out
there.
But it's the only way to talk to people, so you got to do it, you know? But
thank you so much for having us.
I want you in my pocket. I want to just take you guys with me.
I do kind of make me want to have another baby, but not really.
If you found something helpful, insightful, or just plain reassuring in this episode, be sure to subscribe so you don't miss the next one. And if you have a moment, leaving a quick review helps more parents find us.
We're also always looking for great guests, so if you know someone or that someone is you, please reach out. You can find us at whatiwishiknew_ or whatiwishiknew.life.
Thanks for listening. And until next time, stay sane, stay calm, or at least fake it until bedtime.